Yesterday, we talked a little bit about macronutrients. We talked about hunger, snacking, really covered a lot in terms of blood sugar management. Today, we're going to shift gears a little bit and talk about fluid after surgery because the number two thing that I have heard behind snacking is that just getting in fluid is really, really tough after surgery. So, some of you, if you think back to sitting in the hospital bed, sipping out of medicine cups, it seems a little bit daunting to work your way up to 64 ounces a day. And I know that's a really, really big ask, especially coming right out of surgery. But one thing to help put into perspective a little bit is that first week or so is extremely tough post-op just because your stomach is so inflamed. You've got a lot of healing going on. So again, you may remember just having a hard time getting the medicine cups down, but now I know a lot of you, for those of you from my life group joining, I know a lot of you are about 1 to 2 years post-op where you're able to tolerate portions. However, I know sometimes beverage selection starts to change. So today we'll talk about beverage selection, what to pick, what not to pick, and then also dive into some tips to do your best to stay hydrated too. So to get started, we're going to talk about a few of the basics just for after surgery. A lot of you may have heard this already, but I'm hoping to explain a little bit of the why too, on why maybe your clinical staff or your surgeon doesn't want you to drink carbonated beverages, alcohol, caffeine. Those are a few of the big ones that you see. Pretty trendy advice, I would say, but for good reason. And really starting with that first one, so carbonation. If you imagine after surgery, stomach is a smaller size, and really that carbonation of those bubbles can put unnecessary pressure on your stomach. Especially when you're trying to pack in fluids, you're trying to pack in some good nutrition, that carbonation can make your job harder than necessary. So that is one reason why carbonation is frowned upon, I would say. When it comes to caffeine, I know it tends to be a little different from clinic to clinic, surgeon to surgeon. So in my personal opinion, I think a big piece of it comes down to reflux. So caffeine, actually, we have a little sphincter at the top of our stomach, and caffeine tends to loosen that. Alcohol too. So we'll get into alcohol as well today. But really, caffeine tends to loosen that sphincter. And because your stomach size is reduced after VSG, sleeve gastrectomy, whatever you like to call the surgery, that can push that fluid or your gastric juices a little bit farther up and cause some discomfort. So if you're prone to reflux, then I would stay away from the caffeine and alcohol just because that's going to make things worse. However, I think a cup of coffee here and there is not going to be the end all be all. When it does come to coffee, though, I do have a few suggestions. I know a lot of people, that's one of the number one things that they really struggle with is just kicking their morning coffee. And that routine, I know, is key, but I think a lot of it is just that having the smell of coffee and having that be part of routine versus the caffeine itself. So I've heard from a lot of women who, in preparing for VSG, tend to switch to decaf coffee and after a while don't even really notice the difference, maybe outside of that first week or so where you might be working through some caffeine headaches. So looking at choosing coffee, specifically decaf coffee, one thing I wanted to point out, which I don't think is always really recognized, is different processing methods for decaf coffee. So when it comes to your coffee bean, it takes a lot of work to extract the caffeine out of the coffee bean. And there's a couple different methods that companies use to do that. So first of all, method one uses a lot of solvents or chemicals. So really to get that caffeine out of the coffee bean, lots of chemicals are used. So to have the cleanest coffee, I guess, that's one method you may want to avoid. So another method is the water method, or it's otherwise called Swiss method. And really that involves soaking the coffee beans versus using solvents to extract that caffeine. So I just have one that I picked up here from my local grocery store. So hopefully you can see the decaf, but then this one specifically has like a water process too. So again, you may see water process, you may see Swiss process. Those are a couple things to look for when you are looking at decaf coffee or making that switch, because that's going to mean less chemicals in your coffee. So if you have questions on that, drop them below, or if maybe you have a good decaf coffee that you really like. I know sometimes when it comes to switching from caffeinated coffee to decaf coffee, there can be a little bit of a drop in flavor. So you might notice that it's a little bit watered down, so you may want to hit that strong setting on your coffee maker if you've got it. So hopefully that helps with coffee. The next one I promised we would get to is alcohol. So I know typically this is one thing that a lot of the physicians will cover leading up to surgery, again, depending on your clinic, but for good reason. Again, alcohol is strongly discouraged after surgery just because of a thing called addiction transfer. So when it comes to post-surgery, again, post VSG, it could be after gastric bypass surgery, or maybe for those of you who haven't had surgery and are just looking to lose weight. Addiction transfer refers to that transfer of using maybe food to numb or kind of mask some of those emotions to making that shift to alcohol. And really, it's got a double, maybe triple whammy when you look at using food to cope versus using alcohol after surgery, just because after surgery, one of the enzymes that is in your stomach that helps break down alcohol is decreased by quite a bit. So you might notice that one drink, you are just like intoxicated. So you really get your bang for your buck when it comes to booze after surgery. But again, that's not going to be good if you know that you have maybe a little bit more of addictive personality. To take the edge off, really, that is a serious matter. So especially nowadays, we are bored, cooped up at home, and maybe some of us might want to hit the bottle for a little bit of entertainment. But take out your stress or emotions in other ways. Activity, taking good care of yourself, and good self-care practices can help. So one reason, again, that alcohol isn't recommended after surgery is that addiction transfer, you're going to have less of what you need to process alcohol, so it's going to hit you a lot harder. But I would say if it comes to like holidays, birthdays, like a drink, just like your coffee, every now and then is not going to make or break. So we're still living real life. We still want to get in the groove of everything and be able to enjoy those moments with friends, family, social events. Some tips for those moments when maybe you are planning on having a drink. First of all, just having a meal first. So if you have some sort of, buffer in your stomach between you and that glass of wine, that is really going to help your tolerance, and then just staying hydrated too. So if you are having a drink, followed up with some good fluids too. So hopefully that helps a little bit if you're thinking about maybe having alcohol here or there. So in the beginning of this chat, we talked a little bit about, after surgery, stomach is really inflamed, so it can be tough to get those fluids down. And for those of you in my life group, my current ladies, I see some of you on now. I do have a video that I'm working on that I'm going to drop to you guys, because one question I get asked a lot when people start to get close to normal size portions again is, did I stretch my pouch out? Did I stretch my stomach out? So for my life ladies, I have an exclusive video coming for you soon, and we do have a current VSG exclusive group going on right now. So to learn more about that, you can check out my link in bio. Otherwise, if you have any questions on that, you can DM me or let me know, and I'd love to hop on a call just to see if you think that would be a good fit. But again, an awesome group of VSG exclusive ladies now. The interaction has been awesome so far. So thanks for those of you that are on and that have been actively commenting in the app. I really appreciate you guys. And a couple more things before we wrap up for today. So we'll finish off with the tips, but one thing that I wanted to kind of piggyback on this conversation about fluids is constipation. So I know it's not always a fun thing to talk about, but just remembering my days back in clinic, this is a very, very common concern for a lot of women. And especially if you go into maybe pre-op, just struggled like a lot of other women do with constipations, fluids can help tremendously. So we hear a lot about fiber, but really you don't want to do too much fiber without doing the fluids to follow that up. That's just going to bind you up more. So if anything, I would put that fluid first before you're upping your fiber. Otherwise, it can get really uncomfortable. But if you are struggling with constipation, fluids number one, and then movement. So any sort of exercise can really help get things moving along as well. So we will get into some tips and just some suggestions as far as what a good fluid goal would be for the day. So to start there, most people recommend about 64 to 100 ounces a day. And I would love to hear from those of you that are on, like maybe where you think you're at or where you're comfortable. I know that when we start to throw numbers out there, it's hard not to compare with others who are getting a gallon a day, because not everybody has that capacity to do it. So try not to compare to others. And really, if you want something that's a little bit more personalized, again, all this bowel talk today, but one good sign too is just looking at the color of your urine. So that if you're looking for like a pale lemonade color, anything darker than that is going to mean that we need to up the fluid. So of course in the morning it's going to be a little bit more concentrated, a little bit more darker than usual, but that can be a good key just to dial in to see what works well for you. But again, if you're looking for numbers, anywhere from 64 to 100 ounces is a pretty safe bet. Specific to after surgery, again, I know we get into like separating fluids from meal times, and we talked a little bit about that yesterday. So if you missed yesterday's chat, you can hop back to my videos. There is a VSG mini series in there, or VSG mini series. So if you want to see more on that, I will start to keep all these videos in there so you have an easy place to reference. But we talk more about why to keep fluids away from meal times, which can always help if you're focusing on meal, a little bit of a break, and then fluids between meals, making that your goal to hit those. But my first tip is just having a standard container. I know a lot of you might be doing this already, but if you have a point of reference, like maybe it's keeping a certain water bottle at work and a certain one at home and knowing exactly how much you need. So for example, I have a Nalgene here, and this one here, it's 32 ounces. So I know to get to that 64 ounces, I need 2 a day. And that can be easy just to kind of keep an eye on this throughout the day. Temperature can make a big change as well. So if you know that, hey, I do a lot better when it's maybe room temperature where it's not too cold or too hot. I am in central Minnesota, so it's starting to warm up, but it's still a little bit chilly. But getting like tea, I would say can help too if you like more of that warmth, which can also help during the winter time. So I would count those warm fluids or that tea as well. If you are doing things like the decaf coffee, I would count that towards your fluid goals. I know sometimes we hear that coffee dehydrates you, and there may be some truth to that, but it doesn't take away the fact that we have fluids going in, and you can let your kidneys do the rest, deciding what stays there and what goes out. And then also one last tip, I know we're getting short on time for the day, but if coffee is part of your morning routine, one thing that I would mention is just doing like 8 ounces of water before your coffee in the morning. So before you even pour that cup of coffee, get some water in, and I promise that will make a really, really big difference for the day. Personally, it's something that I've worked on, and I noticed just like starting my day off with water versus coffee, whether it's decaf or regular, can make a really, really big difference in just the way that you feel and what you start to crave the rest of the day. So if you've got tips, you can drop them here. I know I want to be respectful again of everybody's time, but if you happen to catch on later in this video, I will post it in a little bit here to that VSG mini series in the videos, and then you can always reference that at a later time. So tomorrow we will be talking about supplements, and I know I see a couple of you on, someone did have a request to talk about like hair, skin, and nails. vitamins, like things to look out for. So tomorrow at noon, we'll be talking a little bit more about supplements and what to look out for there, what maybe to not spend your money on, what maybe is worth spending a little bit extra on. Again, if you feel like some of the topics here are helpful, we go into a lot more depth in my life program. So if that's something you're interested in, I will be sure to include more information in the description when I post this video. Otherwise, you can always check out my link in bio that will take you to a little bit more information. And then I do have a special discount code to save you a little bit. We're covering anything from nutritional strategies to getting back to the basics after surgery. And I would say most importantly, that mindset component. So for a lot of the ladies that are currently in the program, about 1 to 3 years post-op, I think this is really where a lot of the work happens, where that first maybe 6 months, everything melts off quickly. And now we start to kind of put the brakes on in terms of seeing the weight go down on the scale, but that mental transformation is just so key. So come and connect with a bunch of ladies that are on the same path as you. You have me, a registered dietitian, who is guiding you along the way. So I will filter out all of the nonsense advice so you can just get to work on you. But again, questions, comments, concerns, feel free to DM me. I will keep my phone handy in the next little bit here, and I hope to see you tomorrow.